I bet we turned it on today.
Move.
Alright, so we're going to continue with our midterm stuff. We've already started. Are they full? No, I have to look at the Oh, go on. I have to recommend you. You're recommended. You and Jessica, Alejandro, you and Ambassador last year? Okay. Were you? Okay.
Where we go?
Ashley, don't hit that with your stuff, please.
I already walked in front of it.
That's fine. But just don't hit it with your binder.
Wait, am I going by myself?
Yeah.
I'm scared.
Were you an ambassador last year?
No. You weren't? No. Then you can't go. All right. So, how far did we get? 3 pages.
Yeah, we got the
We'll pass it.
double R's.
We'll pass
But this is double R's right now. We
it.
didn't talk about diarrhea.
Yeah, we
We got to that page. And we stopped.
Okay. Suffixes that start with a double R. Rhea means an abnormal flow or discharge, like diarrhea. Rhexis means rupture, so and myo is muscle, so you rupture a muscle. Prefixes are added to the beginning of the word. They change the meaning. It usually indicates a location, time, or number. For example, pre. Pre says it means before. So, prenatal before birth. Natal birth. Peri means around. So, perinatal's around birth. Post is after birth. Here's some contrasting and confusing prefixes. Ab means away. We talked about abduction. Lauren, does anyone have an extra pen or pencil? Yeah. Could I borrow it, please? Let's see. This morning, I couldn't think of the word. You means true. I skipped dis just for a minute. Thank you very much. You true. Of course, it's a southern. You true. Like eukaryote, they have a true nucleus. Prokaryote means no. Pro-note. They have no karyote. I'm just telling you that to give you an example. I couldn't think of the word this morning. Anyway, ab, away from, like abduct, add, towards, like adduct, towards the midline, towards the body. Dis means bad, so dysfunction. You have a dysfunctional family. That's true. Very good. You true or good, normal. Euthyroid, normal. Hyper, excessive, just like you act hyper. Hypertension. Hypotension. Inter means between. Interstitial is between the tissue. Intra, see the difference? Intra. Switch a couple letters, change one from A to E. Intra is inside. Intramuscular, so it's into the muscle. Sub, below, like a submarine. Below the water, marine. Subcostal, below the rib. Supracostal, above the rib. So, you start with the suffix when you're trying to interpret the meaning of the word. So, for example, we're going to just start. Laryngology. You start with the N. The suffix is ology. That means the study of. Then you go to the front. Odo means ear. Rhino, nose. Larynx is your
the camera's right there.
throat. Right. Your windpipe, your throat. So this is actually the study of the ears, the nose, and the throat. Isn't that cool? So that actually means study of the ear, nose, and throat. Or an ENT, ear, nose, and throat doctor. Isn't that cool?
Yeah, it is.
Yeah.
I like these words, they're totally different from what they are back there.
Well, you need to start
I can't, I don't have that.
making flashcards. You need to start knowing these and make it fun. I would say practice them. Go over and over and over and over and over. And you think you got them? Do it 5 more
Like
times.
in these slides, do they have them like, or in the book, do they have them like listed and what they are, what they mean?
They're on right there on your left.
Yes.
Yeah. They're on there. All right, so this is talking about how to use a dictionary. You guys should know how to use a dictionary. Anytime you feel like you need to guess, you can double check it in the dictionary. For example, lithotomy. Can someone show me lithotomy position? How about one of you females? Who wants to lay up on this?
Is that like when you're having a baby?
Yes.
Do that?
Will you actually, I need you to,
No, I won't do it, but everyone knows what it is. Okay, I'll do it.
hold on. There you go, actually.
Can I
No, don't record.
I can't see.
Yes. Can you do it on the table, please?
Yeah, because I can't see.
Wait, you're supposed to be up.
Go ahead. Put your, there you go. So can you do it? Lay down and put your feet up.
You have to hold it.
That's
So
right.
she can get it on the camera.
You have to have 2 people holding it.
There you go. That is lithotomy position.
I'm sorry.
Females go and have a pap smear. You have to put your feet up in stirrups. That is lithotomy position. Also, another meaning, lithotomy, the otomy, you see how we're looking at the end of the suffix to determine this word, the meaning? Otomy means an incision. And lith means stone. So one meaning could be removal of a stone by incision. The other meaning is this position that Jessica so very well showed us.
Yeah, I did.
So this is actually how to look something up in the dictionary. The first word is on the left. That's the first word on that page.
I don't think you guys need to go over this.
I agree. I'm going to skip it. And,
Skip what?
oh,
How to
so
use a dictionary.
here's some that might be unfamiliar. If it sounds like an F, it might be F like flatus. What's a flatus?
No idea.
My daughter giggles after she makes a flatus.
Oh.
Fart. Or pH, like phlegm. Can you clear some phlegm from your throat, please, Tyler? Very good. J could be G, like gingivitis, or J, like jaundice. K could be crepitus, or kyphosis, or, I don't really get this one, quadriplegia, or quadriplegic. That doesn't sound like a K to me. It's more of a QU. But does it sound to you guys? Quadriplegic?
I can see how they can do that.
Yeah?
Well, I think you can tell your Q's apart because it always sounds like Q U's together.
I agree, but I was wondering if Mexican, you know, how they pronounce it, if you guys thought it was a little bit different.
What? How do we pronounce what?
Quadriplegia?
Quadriplegic?
Huh?
Where's that?
No como? She doesn't know. Alright. Moving on. Pronunciation. A word of caution. They're based on Greek and Latin, but we tend to pronounce them in English. Yeah, I don't really understand this. I don't know if this was a mistake or if this was done on purpose. Do you see anything wrong with the first bullet? Show me.
One or 2 letters changes.
IMPORT.
Yeah, changing two letters. So I wonder if they did this on purpose.
Probably.
I think they did.
But
Did you
what
not
does
make
that
it?
mean?
Wasn't he changing
Many
the life or
names.
death?
Well, no, what they're saying is if you change one or two words,
I
you
know.
can change the meaning of it.
I know, but there's not a meaning for the name.
I think it was just.
An act, yeah.
Or maybe it
Anyway,
was a typo. I've done it before. So it's like-
anyway, and then the whole, what?
They've had a lot of typos.
Yes, yes. And I thought that I corrected them. I saved it under something else, and I gave you guys the original. So, yeah, sorry about that.
Wait, it says be below knee, burial in email.
Yeah, you have to be careful with some things, like VE. It's actually below the knee. That's talking about amputations. You have above the knee and below the knee. But it can also stand for barium enema. Those are totally different. You know what an enema is? What is it, Lauren?
They stick a giant needle. I don't know, I got it off the cereal movie.
It's not a needle, but go ahead.
They stick this, isn't like a water pump up your rear end.
That's right. They stick it up there. A lot of times, some doctors do it before you have a baby. That way, when you're, well, let me tell you what it is first. She's right, except it's not really a needle. To me, a needle sharp, but it's kind of like a syringe full of water. And as soon as it gets up in your colon, you have to immediately sit down on the toilet and it cleans you out. So when you're bearing down to have a baby, they tell you to bear down like you're trying to have a bowel movement. That's how you bear down. So if you're bearing down like that, can you imagine that you might have some feces come out? Anyway.
It happens.
It happens, that's right. Crap happens. Alright, so singular vertebra, plural vertebrae. Appendix versus appendices. Diagnosis versus diagnoses. Arthritis, arthritis, I don't know about that one. Phalanx, phalanges. Ganglion, ganglia. Diverticulum, diverticula. Alveolus, alveola.
Somewhere in the middle of your,
What?
talk, the camera moved.
That's fine. Is it recording? That's fine. So, sign versus symptom. A sign we talked about, something that somebody can see. They can see that you have a fever, or you're vomiting. A symptom is nausea. Only you can feel it. Only you know it's there. Okay? Objective is something that other people can see. Subjective is only by one person. So I try not to grade on subjective things. I try to grade you guys on, or as objectively as possible. For example, like for math, there's a right and there's a wrong. Anybody that grades it can tell if you're getting something right or wrong. The only things that I grade you guys on that's subjective is the employability skills. 5 things: trustworthy, attitude, responsibility. Right. It's my opinion. If I don't like you, I can make it work. Make you like you. I really don't care for you, so you're going to get negatives all the way down.
Oh, darn.
A diagnosis is an identification of a disease or problem. You diagnose is the process of reaching that decision. Your prognosis is the prediction or probable course or outcome. Acute is something that is rapid onset or short duration, less than 3 months or less. Chronic, 3 months or more. An eponym is something that's named after somebody, which a lot of procedures are, especially surgical tools, instruments, but for one example, Alzheimer's disease, it was named after the guy that discovered it, Aloy Alzheimer. An acronym, Alzheimer's? Alzheimer's? I wrote a paper about it in high school, and I called it old timers. Old timers. An acronym is like an abbreviation, but it stands for it. CT stands for computerized tomography. You can say CAT scan a lot easier than you can say computerized tomography. SWAC, that's an acronym. So some look-alike, sound-alike parts of the word. Arterial versus endoarterial. Athero, plaque or fatty substance in your arteries. Arthro is joint. Ilium versus ilium. Ilium with an E is your intestine. Ilium with an I is your hip bone. Infection versus inflammation. I think you guys know what an infection is. Inflammation, swelling. That's right, swollen. Lacerations where a wound is torn, but a lesion is tissue damage. Mucus versus mucus. To me, it's not important that you know mucus versus mucus. I don't know the difference. I'm not going to hold you responsible for that. So put an X on that.
Mucus and mucus.
Myco is fungus. Myco. Myelo is bone marrow or spinal cord. Myo is muscle. Ologist is the person who specializes. Ology is the study of. So biology is the study of life, and bio is life. Pharmacology, study of medication. Ostomy and otomy. An ostomy is to create a new opening. So if you have colon cancer, they can take your colon and reroute it so that it comes out your stomach or your abdomen. Yes. And then you won't have feces coming out your anus anymore. It'll come out into a colostomy bag. You can have an ileostomy where it comes out instead of your colon, it's the ileum. Otomy is an incision into. You can have a laparotomy, means an incision into your abdomen or your lap. Palpation is where you touch something, like you palpate your lymph nodes, see if they're swollen. Palpitation is a racing heart, so your heart beats really fast. That's right. But people say they have heart palpitations. It's abnormal, it's really fast. Prostate versus prostrate. The male gland right underneath their rectum. Their bladder goes through it. Or prostate means collapse. Pyelo, pyo, and pyro. Pyelo is talking about the renal pelvis, part of the kidney. Pyo is pus. And pyro, like a pyromaniac, they love fire. Alright, so this is a true thing. How many people want to be a nurse in here? Alright, 3. Well, when you're charting, you never put down that something is pussy. You would say that it is full of pus, or what the pus looks like, the color, the texture, or smell. In nursing, you do everything except for taste. You have to make it as descriptive as possible. Some people think that I'm kidding when you don't say something is pussy. Why do you think that is?
Because the way it's spelled.
That's right. Okay? That's not a joke. I mean, you can laugh, but I mean, I'm just being honest.
Yeah. I just know that. I just know that.
Yeah. Supination and superation. Jessica showed us supination, or how she remembers being supine versus prone. Because supination, you're turning over, so you can hold soup. You're laying prone, belly up. Prone, God bless you. Prone is butt up. Suppuration, formation or discharge of pus. Okay? Suturing. A suture is incision by stitching or stitches. You don't really say stitches, you say sutures. And to use medical, I mean, lay people say, yeah, I got some stitches. But people that have some education say sutures. Ligation, that's tying off blood vessels. It doesn't have to be just blood vessels. Have you ever heard somebody say they got their tubes tied?
Yeah.
That's actually ligating their fallopian tubes. There are several techniques. You can cut them, you can tie them off with,
Can you burn them?
you can burn them. That's right. There's several different things. You can put a ring around it, and then it will necrose and die, and then no longer can go straight. The sperm and the egg have to meet, and then they have to be able to go through the fallopian tubes. Some docs do use different techniques because of you might want to go back, decide, you know what, I do want to have another kid. Well, some of these techniques, it's easier to just cut on the other side of like a burn, and then anastomose or reattach the two ends. If you have one testicle, you can still produce sperm. It's the same way. If you have one tube, you can still get pregnant. If you're having trouble getting pregnant, one thing they could do is squirt some dye-colored fluid through your uterus and see if it goes on through, because you can watch it come out the fallopian tubes at the end with the fimbriae. Just stick it in there. Triage and trauma. Triage happens when you go to the ER. If you are bloody and you have a knife sticking out of you, you're going to be triaged ahead of someone that just has a stomach ache. They determine what is the most life-threatening. Sorry. Trauma. Trauma just means you've been in an injury or an accident and you have a wound. Viral and viral, or virile. Virile, I guess, masculine traits. This was new to me. I didn't know it.